Hi, my name is Dr. Karen Maurice. I'm the program director here at Burke Rehabilitation Hospital for the Sports Medicine Fellowship. Welcome to our presentation. I want to tell you about the Sports Medicine Fellowship here so you can get a better idea of what it is that you're in store for here with your training. I want to start out with what our vision and mission statements are so you know what we're about. Then we'll go a little bit more big picture in what Burke and Montefiore are about, who are the people involved, who we report to, who you'll be working with, and then we'll bring it into what exactly the fellowship training program entails. So our vision, this is a primary care sports medicine fellowship at Burke Rehabilitation Hospital. And what we want is we're committing to becoming a top tier program in sports medicine. We want to produce leaders in the field by aligning our program with the fellow's goals and interests and offering the highest quality education. How are we going to do that? Our mission in training the next generation of physicians who are striving for excellence in evidence-based care. And as you can see, I'm highlighting a few things. We're focusing, of course, on sports participation for people of all physical abilities, so sports and other physical activities. And we want to do this by an interdisciplinary approach, sharing our knowledge, our skill with our clinician colleagues, with the patients and the community we serve. We have a big emphasis on the community, and you'll hear me talk about that a lot. So this very messy picture is really just to let you know that we are part of the Montefiore Health System. And as part of that, there's an academic side, a medical side, a community side. So I want to show you how there are multiple hospitals in the system. Burke is a standalone rehab hospital within that system. And then there's a very big community health component. And of course, there are a lot of people involved and employed through the Montefiore Health System. And our academic arm, we are very closely linked with the Albert Einstein College of Medicine. I'll talk more about how we work with them. So this is beautiful Burke Rehab, kind of in the spring, summer. So I want to introduce you to our beautiful campus. We're coming into the fall months where we're going to have a little more of the foliage. We're on a giant, beautiful campus you'll see a lot of the outdoor spaces with the colonnades, the track that's on campus. We use that a lot. With our inpatients, with our outpatients, with our sports patients, with our adaptive sports. And to introduce you to the inpatient rehab hospital. Now, that's not somewhere where you'll be spending much time as a sports medicine fellow, but you should know the bigger context of where you'll be working and training. So Burke Rehab, it's a 150-bed acute rehab standalone hospital that offers all of the rehab services, so including amputee, cardiopulmonary rehab, brain injury, neurologic, orthopedic, spinal cord, stroke, we have it all. And on the outpatient side, we have a far reach. We have physical therapy, occupational therapy, speech therapy, locations pretty far reaching. So when it comes to our outpatient musculoskeletal and sports medicine practice, we have a very far reaching area that we're getting patients from. And that also means we have a lot of services to offer them in a lot of areas. Bringing it back to the community, so Burke Rehabbed as a whole, but also the Sports Medicine Fellowship more specifically is very committed to the community. And as a few examples, we have awareness and education events such as Heart Health Month and National Stroke Month. We have 11 monthly support groups. Those have all gone virtual for the time being, but they are still ongoing. We have annual events in collaboration with Montefiore, including Heart Day. There is an adult fitness center, closed for the time being for safety reasons, of course, but this is designed for people who are 40 years and older. So when we're talking about sports medicine and its applications, we're not talking just about elite athletes, competitive athletes. We're talking about the whole community, including the older age range, because that's who our community is. So we have certified personal trainers who build programs that are specific to individuals' health and history, and we offer all kinds of classes at the fitness center. Here's a picture of the adult fitness center with one of the trainers there, so you just kind of get an idea of the community participation here. It is very popular. And of course, we have a fantastic, well-established adaptive sports and recreation program here at Burke. That's one of the things that is unique to our program. Here are a few pictures of some of the types of events that we hold. So we have hand cycling, golf clinics, adaptive alpine skiing clinics, adaptive water skiing clinics. And those are things that the sports medicine fellows are definitely involved in. In fact, just this year, the fellows have been working very closely with the head of adaptive sports and recreation to create new safety protocols to reinstitute adaptive sports in this time where we are thinking a lot about safety and social distancing. Looking now more specifically at the people that you'll be working with. So down at the bottom, you'll see me. So I'll be your Sports Medicine Fellowship Director. And arching across the bottom there, we have the other program directors, Dr. Travato with the Brain Injury Fellowship, Dr. Seidel with the residency, PM&R residency that we have here. And I mention them because we all work together in an interdisciplinary way. There's a lot of teaching that goes both ways, kind of from top down, the faculty working with you on teaching, but we also want to create great educators and in teaching other people, you learn better. So there's a lot of teaching of the residents. I'll show you when we get to the Albert Einstein College of Medicine, we also teach with the medical students. So there is a lot of teaching that also happens by the fellows of the PM&R residents. We report to Dr. Opark, who's the Chief Medical Officer and Senior Vice President, who then reports to Jeff Menkes, the CEO and President. Dr. Bartels is the Chairman for the Rehabilitation Medicine Department. But then you'll notice off to the side, we have Dr. Elishvili as the DIO, the Designated Institutional Official for our ACGME programs. And the reason I want to point this out is notice she doesn't report through us up to Jeff Menkes. She's separate because we want to make sure that there's a lot of oversight into your education, making sure that you are getting a good quality fellowship so that if there are any issues, concerns, that you have someone directly to go to outside of your direct superiors, so to make sure your concerns are really addressed adequately. Your other fellowship faculty, so we have Dr. Curavilla, who is physical medicine and rehabilitation trained and board certified, and also sports medicine board certified. You work with her in the outpatient musculoskeletal and sports medicine clinics, also with ultrasound teaching, diagnostic ultrasound, and ultrasound guided injections. Dr. Singh is our pain medicine physician, also physical medicine and rehabilitation board certified and pain board certified. You work with her for the interventional pain procedures in the office and also for the procedure time. And then also working with her for ultrasound teaching and ultrasound guided injections. Dr. Vadia is a huge asset for us, kind of trained in everything, including family medicine and physical medicine and rehabilitation and sports medicine, board certified and everything. And he is a huge resource for us for teaching as well. And then a couple of group pictures showing you how we do cover mass races, mass events, and also how we work in an interdisciplinary manner with the Montefiore Health System. So I'm in a group picture off in the little picture with the bright hat on. I was covering the New York Marathon. This is 2019. And I take one of the earlier tents. The other picture is from the finish line tent. I take one of the earlier tents. I'm at mile 5 or 6. So I'm the only physician there. I'm the tent captain. I'm running the whole thing. So these are opportunities that you have. I take an earlier tent because my husband runs the marathon every year and I need to finish early so that I could get to the finish line, pick him up, take him home, and make sure he doesn't pass out for the rest of the day. And then Dr. Opark is in the other picture with 2 recent Montefiore Sports Medicine Fellows and one of the Burke Rehab residents, because I wanted to show you how being part of the Montefiore Health System is a benefit to all of us. We are a standalone hospital with this beautiful family feel with all of the benefits of the big health system. And then in the orthopedics department, we work with a private practice group that is very close to Burke. The main person that we work with there is Dr. Yasmin Dar. She's the sports medicine and arthroscopic surgery specialist in their practice. You spend most of your time with her, but you can also rotate with some of the other people in the practice, working in her private office, working in the hospital clinic, and also spending some time in the operating room with us. And so now more specifically, what do you do on a day-to-day basis? The rotation sites, 10 months of the year, you spend at Burke Rehabilitation Hospital in our outpatient site in the outpatient musculoskeletal and sports clinics with the faculty that I mentioned earlier. And we have a beautiful new outpatient office that I hope you'll get a tour of today. You spend most of your time with the sports faculty. You also rotate through cardiac rehab. You spend time with concussion and in the adaptive sports program. Once we're able to open things back up again, you'll spend a little bit of time in the fitness center so you understand how the community fitness center works, and in pulmonary to see how their exercise prescriptions are affected by their pulmonary issues, because again, we're treating the entire community. You also spend 1 month of the year in the orthopedic sports rotation with Dr. Dar, and 1 month in the pediatric emergency department at Montefiore Medical Center in the Bronx. This is the one time that you won't be very local here, because as a standalone rehab hospital, Burke doesn't have an emergency department, so this gives you an opportunity in the pediatric emergency department to see more of the younger population, acute injuries, trauma and fractures more than you would see in the outpatient office, and also non-musculoskeletal acute sports rehab or acute sports injuries. And in terms of sporting event coverage, we are affiliated with Monroe College through Dr. Dar, covering their sporting events, but also their training room and doing the pre-participation physical exams. And we have locally the New York Roadrunners, which is a gigantic running organization for the New York metropolitan area. They put on several races throughout the year that are very popular because you have to run, you join a lottery, and not everyone gets into the lottery. So for guaranteed entry into the New York City Marathon, which is the world's largest marathon, very popular, and we are fortunate to be able to provide some medical coverage for that. A lot of people, in order to qualify for that, need to run 9 of the New York Roadrunners' other races per year. So it's everything from 5K, 10K, half marathon, up to the marathon, and they need medical coverage for that. So those are opportunities throughout the year for mass events. There are other events that happen just once throughout the year, triathlons and things that we can cover throughout the year. So who is our sports team? Who are we working with? So of course, we're thinking sports, and so everyone we're working with is part of our team. So of course, there's your patient, but we're also working with their family and their other caregivers. There's the more specific sports faculty, so the fellows, the PM&R residents that are here doing their training. We also have neuropsychologists on staff, physical therapy, speech therapy, occupational therapy right here on staff, and then throughout multiple sites in the area and pretty far reaching. We have a very well-developed, well-established adaptive sports and recreation program right here on campus. We have the fitness center, we have the track, we have multiple events that take place throughout the year right here on campus, but also far-reaching, things that we can't go, of course, right on campus, like skiing and sailing. So we are intimately involved with them. There are nutritionists, athletic trainers, exercise physiologists, also available right here at Burke Rehab. We work with the coaches and athletic trainers at our affiliated schools. We have pharmacists here to help us, and then, of course, we can consult any other specialists that we feel are necessary. What is your role here as a fellow, and what's my role in teaching you? So you start out as a medical student, and then you get into training. You're a physician, and you become a resident, and then now a fellow, and you want to leave as a full-fledged attending, ready to treat patients on your own and make your own practice. So as a fellow, you're caring for patients, for the family, again, for the community, under our supervision, of course. You're integrating your knowledge into this practice that you are creating for yourself as you leave here. So you're establishing those practice patterns that you're going to take with you for years to come. We're emphasizing this joy and curiosity and problem solving in academics, in discovery. And of course, there's an emphasis here on well-being for you, for the faculty, for your patients, for all the members of the healthcare team, because how are you going to take care of someone else if you're not in good shape? So where's my role in that? What's my teaching philosophy? Honestly, for me, I didn't go into medicine for teaching. Really, it all comes down to patient care for me. And so I've become very passionate about teaching residents and fellows and medical students, and of course, specific to you, the sports medicine fellows, because I want that to translate into better patient care. That's why I help you with becoming more efficient in your day-to-day. I will teach you all kinds of things about the electronic record system to make you more efficient, because if you can do that more efficiently, now your energy goes into taking care of patients and not staying late at the end of the day and going back home to your own life so you can be a whole person. I want to encourage you to do research, because research leads to discoveries that can help with patient care. I want to help you improve your knowledge, because that's going to translate into better patient care. So that's what brings that passion to me in teaching you, because when I teach you, you can bring that out to all the patients that you're going to be treating later, to our whole community. What do we do for specifically the teaching? This is, of course, a one-year program, so we're on a 12-month cycle of didactic lectures. So we have weekly didactics structured in more of a lecture style. We also have monthly grand rounds for the entire hospital. We have journal club with Dr. Curavilla that are sports specific twice a month. With the Albert Einstein College of Medicine, our affiliate medical school, we have a cadaveric dissection, and we do it a little bit later in the year, so you're not going back to first year of medical school and dissecting these cadavers all the way from the beginning. The medical students actually already did it for you, and we get to benefit. They have done most of the dissection, and then we can go in and benefit from that by practicing physical exam maneuvers, teaching the residents and medical students, and also practicing injection techniques. We also have regularly scheduled ultrasound didactics at least twice a month. Dr. Opark also has weekly inpatient musculoskeletal rounds that often involve the ultrasound, so another chance throughout the week to do that. And then for those of you who are physical medicine and rehabilitation trained, we have the option of attending EMG workshops as well, so you can keep up that training. I wanted to show you an example of our ultrasound teaching. So this is Dr. Opark working with us. We have a state-of-the-art ultrasound that we use for both teaching and also that we use on diagnostic musculoskeletal ultrasound exams of our patients and for injections. So this is Dr. Downey, who is our faculty at the Albert Einstein College of Medicine. She is both part of the anatomy and structural biology department and the rehabilitation medicine department. So we do work very closely with her. She is an amazing instructor and invites us all the time to do research projects. You can get involved in all kinds of research projects through her department involving the anatomy lab, and she's very generous with that. And then we do the teaching in the lab. On the right there, you have the example of some of the residents going in and then the fellows go in and do that teaching with the residents. Dr. Downey actually was one of my anatomy instructors when I went to medical school at New York Medical College, which is nearby, and we reunited at Albert Einstein. If you choose to attend the EMG lectures to keep up those skills for the physiatrist background, here's an example of some of that teaching that goes on with Dr. Opark and also with Dr. Seidel. There is a research requirement. You do need to be involved in a research project that comes to some sort of fruition throughout the year. We do encourage you to participate in the various academic conferences, including the sports and physiatry annual conferences. There is funding to help you submit and attend those. Of course, they're all happening virtually now. That includes quality improvement projects. So the fellows are also each on at least one hospital committee. So there are several committees, so there are several options. Currently, our fellows are on the operational performance improvement committee because that is more outpatient focused, but that can also, the projects that could come out of that can go towards the research requirement. And how do we evaluate you formally? So there are, of course, the core competencies that you're familiar with through the ACGME because they're used in residency, but we also use those in fellowship, so you're familiar with those. And here's an example of the milestones, and not that you need to read through all of these, but out of the 6 core competencies, each of those have multiple descriptions in there that you get evaluated on all of those. So I just want to show you that there is a very formalized evaluation method. And the additional forms of evaluation include evaluation by your faculty throughout the rotation. There is fellows pretest through the AMSSM at the beginning of the year and then about halfway through the year. So this can also evaluate you against the fellows throughout the country. The objective structured clinical examination, also known as an OSCE, you're probably familiar with that from residency, so we continue that. You keep a procedure log. We have quality improvement activities, evaluations, either through new innovations or through other monthly evaluations by the faculty and also by you of the faculty and of the rotations. The milestones I mentioned. We also have what are known as 360-degree evaluations. So it's not just between you and the faculty, but all of the people that you work with, so including the psychologists, the therapists, the trainers. We have regular clinical competency meetings. And then, of course, you meet with me a couple of times a year so we can talk about how you're progressing. And just the benefits, just to kind of go over some of that, pretty standard for a large medical institution. The salary is $80,000 for the year. We do have an option of housing available on campus if you do need it. A lot of the residents live on campus as well. Health insurance, disability insurance, vacation, conference time, sick time, lab coats are provided. We do provide funding to attend conferences if you're presenting at those, and an educational stipend to offset some of the costs, such as textbooks. And to bring back wellness that I mentioned earlier, there is certainly a heavy emphasis on wellness by the institution as a whole, by the residency program, by the fellowship program. I keep mentioning the fellowship program because we are closely linked with them. It's incorporated into the program through structured learning sessions and workshops, but also the institution has supplemental help available, such as the Employee Assistance Program, which is being promoted a lot, particularly lately. This is something that we definitely want people to get help in if that's something that you need. This is a very hard time in your life. There are a lot of transitions. You're probably moving, you're leaving one program and finishing something and starting somewhere else, and then you're only here for a year and then you move on somewhere else. So this is actually, we recognize this is a very stressful time of life. These are confidential resources that are separate from me, separate from the faculty, so you don't have to be concerned this is going to affect your training in a negative way. So I hope this was a helpful introduction to the fellowship and that you've gotten a better idea of whether this is the right fit for you. I want to make sure that that we're providing you with your needs for the future that you envision for yourself.